To scan spleen of a patient, the patient should lay down on their back, keeping the left side of the body towards the operator. The left arm of the patient should be underneath the head in maximal abduction. The patient should slightly rotate his body towards the right side, meaning in a slight right lateral position. After selecting the spleen on the patient's information section, the ultrasound probe became active. The vertical line on the side of the ultrasound probe should face the patient's head. The probe should initially be placed vertically on the posterior axillary line at the level of the xiphoid process. The probe then needs to be rotated clockwise to place it along with the intercostal space. We need to move and rotate the probe in various directions until we find the center of the spleen. The spleen is always anterior to the left kidney. Here we can see the spleen, and now I am trying to bring the center of the spleen along the vertical dotted line on the Fibroscan screen. Now we see the center of the spleen is focused, and we can see the kidney as well. At this point, I will mark on the patient's skin with my finger or a marker where I found the center of the spleen. Then I need to swab the ultrasound probe with the Fibroscan M probe. The probe must be 90-degree angled with the patient's skin. We need to have a layered homogeneous TM mode and a linear A mode with optimum probe pressure like the liver stiffness measurement. The quality of the elastogram must be checked for each measurement. 10 valid measurements are to be captured. There is no IQR and median percentage for the spleen stiffness. The measurement depth for the spleen is up to 55 mm, and the final result is the median of all valid measurements. All inaccurate readings, including any measurements taken from the non-spleen areas, will be automatically invalidated. A separate report will be generated for the spleen stiffness. Now that the spleen stiffness is done, we will switch to liver stiffness and cap measurements. The patient will switch his position, and now his right side of the body is towards the operator. Most of you are aware of the positioning of the liver stiffness. As you already saw, the tips and tricks menu has a short tutorial for patients' positioning, skills, and important tricks that are required to quality measurement. By using the ultrasound probe, we can localize the liver as well. The probe becomes active when I select the ultrasound probe on the Fibroscan screen. The vertical line on the side of the ultrasound probe will again be towards the patient's head. With the help of this ultrasound probe, we can now easily localize the liver in obese or post-hepatectomy patients. We will follow the anatomical landmarks to place the ultrasound probe. The probe should be placed on the mid-axillary line at the level of the xiphoid process. First, we need to place the probe vertically, and then we'll rotate counterclockwise so that the probe can focus through the intercostal space. We need to keep rotating and tilting the probe in different angles and directions until the center of the liver is focused. This is the center of the liver. Now I will swab the ultrasound probe with the Fibroscan probe to take the stiffness and cap measurements. Now the test is complete, as I have 10 valid readings and an IQR and median percentage of 30 or less. The percentage of continuous cap measurement is showing up here. The new M and XL probe can now measure much deeper tissue. The two depth measurements of the XL probe will be automatically adjusted based on the distance between the probe and the liver capsule.